Greetings, everyone. My name is Smisha Agarwal. I'm an associate professor in the Department of International Health, where I direct the Center for Global Digital Health Innovations. Our center collaborates with programs, implementers, governments, and development partners engaged in digitizing healthcare systems globally. We provide guidance using evidence-based approaches on investment in and implementation of digital health programs. As a result, I observe digital health programs across settings, speak informally to Africa and Asia-based developers and digital entrepreneurs, and support normative agencies to develop guidance to systematically invest in such systems. As part of the WomenLift Health immersion, I had the opportunity to take a step back and think deeply about something that has long concerned me about the way that we approach digital development. First and foremost, the operative word in digital health is health. It is ultimately about providing high efficiency preventive and curative services to the most marginalized populations in the world, which is why how we digitize really matters, and it directly impacts the health of the communities and the services that are offered. To rapidly digitize healthcare globally, the development community has supported the creation of several open source products. They might be classified as digital public goods or global goods. The concept of open source is not new. It is powerful and holds great value. Any technology takes time to build and to perfect. When software products are built on an open source platform, the source code are freely available for others to use and adapt. As a result, the overall cost and time taken to build a technology and to deploy it might be lower. Open source tools, in theory, might also be helpful for countries which have lower engineering capacity to adapt an existing system to their use case. The challenge, though, especially in the context of global health, is how these open source products are sourced, financed, and managed. To test my observation, in mid-2023, my team analyzed digital public goods that are curated by the global donor community. We looked at two portals or curation spaces. The first is the Digital Public Goods Alliance, and then the Digital Squares Global Goods Guidebook. To examine the origins of the digital products, we analyzed the location of the company which developed the product, as well as the location of the CEO and the founder. What we identified was 78 products that are recognized as global goods or DPGs. Of these, just 14 or just 17% companies have registrations in LMICs and founders who live in LMICs. Just to note that these are products that are curated by the global donor community and largely targeted to LMIC governments, but few of these products are actually from LMICs. In another analysis that our team led of a smaller subset of these products, we determined that several of these products that are classified as open source don't actually cannot actually be used independently by developers without the support of parent company. Why? There are several reasons, one of which is that the products do not actually have documentation and development communities, as is typical for high-quality open source products. So imagine this scenario. The global development community has provided airplanes, which in theory, with minimal investment, can accelerate development. But we have provided no instruction manual on how to fly it, and nothing on what all the controls mean. In some cases, we may decide to train a few pilots to fly the airplane, but build no capacity in troubleshooting and fixing the airplane. So to leverage this low-cost resource of an airplane, the recipient may build runways, perhaps detracting from essential highways which reach the poorest of their people. But then as pilots start having issues, often midair, they must turn to the benefactor to send expert engineers to fix the problem. You can see the potential domino effect of challenges that might play out in such situations. The way that several DPGs are created, developed, and managed have far-reaching implications for healthcare outcomes and global equity. They have the potential to strengthen or undermine local technology development markets. They can foster or neglect sustainable development of the healthcare sector, or further and marginalize the capacity of countries to build self-reliance and resilience in the face of the next pandemic. When paper-based health service delivery systems are prematurely digitized, it can really undermine and weaken the capacity of the countries to deliver health services when these digital systems no longer work or need to be replaced. We really need to think about the long-term economic implications of donor-funded software that have largely American and Eurocentric developers, and software that come at a price point that is only sustained by donor aid. Are these solutions feasible in the long run and justifiable if the ultimate aim is to build self-reliance? As we know, it is both prohibitively expensive and disruptive to switch software within healthcare systems. Keeping long-term sustainability in mind, how can we invest in furthering local engineering and technical capacity in LMICs, alongside deploying software that needs that support? History has dictated that over and over, as a community, we have prioritized near-term fixes rather than longer-term strategies to build health systems. But in this case, our approach has the capacity to not just hinder sustainability of our efforts, but cause long-term harm. So, I leave you all with a set of questions to ponder. How can we accelerate digital development while also supporting local economies and potential for local entrepreneurs to thrive and support their governments? What steps can we take to facilitate diversity of participation in digital development, especially where software and systems are concerned? And how can we decentralize and democratize control of digital products in healthcare to really put countries in the driving seat? I'm really looking forward to discussing these challenges further and collaboratively identifying and testing solutions. I thank you for your time.